Hi, good morning. I'm Dr. Ben Newman, and this is Ask Dr. Ben. I study coronaviruses, and I'll try to answer your questions. Um, Next question is from Debbie, and hi, Dr. Ben. Another Nilesite here. It's a you have two very Niles names. Just familiar from growing up. Let's see. I have a question about masks. Come on. If I get COVID, test positive, I know that I should have antibodies for a period of time. Yeah. You would have detectable antibodies starting about a week after infection and peaking probably about a month after infection, or maybe 21 days, maybe 3 weeks after infection. All depends on how quickly your immune system engages. And yeah, it's hard to give exact numbers because the range of what people do, like internally in response to COVID, is enormous. Yeah, so let's see. After I recover, do I still need to wear a mask when I'm around family and friends, even though I'm most likely immune for a while? I would say yes, because exactly like I was saying, the error bars on this immunity thing are enormous. There are some people that do not appear to make antibodies, and heaven only knows how they are able to clear the virus, but it's a couple percent of people in the studies I've been reading. There are other people that seem to make enormous amount of antibody that will last for a long time. And the thing is, we know that antibody levels go down, and there is not currently a test that can tell you whether or not your antibody levels are sufficient to actually stop COVID. We're getting a little closer to that with some of the vaccine work that's been done, but you never know when your warranty is going to expire, basically. Yeah. So, yeah, I would say just for the sake of um, one, just being on the safe side, and two, when I see people walking around without masks, the charitable side of me says maybe they had COVID. The less charitable side of me says put on a mask right now, you maniac. Why would you, put me at risk and everybody else at risk? Yeah, again, you maniac. And yeah, I feel like I'm not alone in this. I think there are other people as well. So I don't know, unless you're trying, I don't think you're trying to cause a ton of distress to people at random. Um, yeah, when you're in your house, I think it's fine. When you're in like little closed office or something like that, if you got something like that at work, I think it's fine. Anytime you're out with the rest of the public, I would say, yeah, it'd be really nice if you'd put a mask on. There may be some immunity for some amount of time, but you don't know how much or how long or when it's going to run out. And until then, yeah, it's just like antagonizing all the people that are trying their hardest not to catch it. So please don't. Yeah. So I luckily haven't caught it yet, but if I do catch it, that's the course I plan to take as well. So mildly unpleasant, yeah, but that's how it is. All right, thanks very much. This has been Ask Dr. Ben.